Hello everybody, just wanted to give you a quick little snippet on meningitis. So let's remember that meningitis is an inflammation, right, on the layers of the tissues that cover the brain and the spinal cord, the meninges, and the fluid-filled space between all of that is exactly what is getting inflamed. The subarachnoid space is what it's called. So the meningitis can be caused by bacterial, viruses, fungi, other disorders, and brain trauma, some other infections that we're going to talk about, and medications. Some risk factors. So these people are at higher risk for developing meningitis, traumatic brain injury, syphilis, mumps, herpes, brain tumor, post-op cranial surgery, streptococcus pneumonia, hemophilus influenza B, paramiavirus, enterovirus, and other neurological disorders. It's important to know these risk factors because if someone comes in with your signs and symptoms of meningitis and they have had a history, especially of the viruses or strep, then you need to pay attention that that could have crossed over and caused the meningitis. So your assessment, you're going to do your assessment. When you look in your NCLEX book from Saunders, you will find all the meningitis information in the pediatric section, and that's okay. If you have, I believe, version 9, then it's on page 470. But it lists the symptoms, and I want you to pay attention when you're looking at these symptoms and start thinking about things you can do to help relieve the symptoms. So first and foremost, they're going to complain of a headache, right? The light may bother them a little. They're going to have fever and chills. Diarrhea, vomiting can occur. And the vomiting usually would occur first because the head is hurting so bad, which doesn't help. Like, that makes it worse, okay? Um, Poor feeding or anorexia. So remember, when we say anorexia by itself, that means decreased appetite. That is not the disease process of anorexia nervosa. Nocturnal rigidity, that is the neck, right? Poor or high shrill cry if they're small and they cannot speak. The level of consciousness tends to go. Remember that not just children can get meningitis, they're just more apt to get it more often. But if adult gets meningitis, you're going to see that level of consciousness change pretty quickly. Lethargic, very, very irritable, all of a sudden very cranky. A little tiny baby may have some of that bulging fontanelles. Remember, you should have learned that looking at bulging fontanelles means that there's an increased pressure in the brain. Sunken fontanelles means that they're dehydrated. So, some of the biggest things that we do as nurses when we suspect meningitis, first and foremost, we're remembering that diagnosis is not our job, but we still know we have to be in tune on what to check so that we can give our assessment to the physician to compare to their assessment. So positive Kierkegaard sign, and I'll go into detail in a minute, and positive Brudzinski sign. The muscle and joint pain is apparent, especially if they had some kind of infection like the influenza or the strep. If they started getting the petechial or peperchal rash, it more than likely will be on their trunk. It will look like a whole bunch of little red dots all over the place. Remember, that's not the key thing. We have to have these symptoms in combination of each other. They all can indicate something different if that's the only symptom they have. So, and then you need to check the ears and the nose for drainage. So this is a good picture of the positive Kernig sign. So what you're going to do is lift the child's leg. Most of the time if you see questions about this, you're going to see it as written inability to extend the leg when the thigh is flexed anteriorly. So it really does bother them. It hurts quite a bit. That is the signal getting across to the brain. The positive Rudinsky's also hurts. If you are laying the patient flat and you lift their head up, their knees will automatically start coming up. If that's what's going on, then you definitely have a positive Rudinsky's, and it's very much so associated, especially with the headache and the other symptoms, with meningitis. So you have to figure out what to do, right? Knowing what to do takes you back to being able to answer all of your questions and being able to do direct patient care with your patient. So when you're doing questions and you know your signs and symptoms, your risk factors, what tests to look at, and what complications, you should be able to apply to the questions your abilities as if you were at the bedside. So when you think of these questions, I want you to think about walking into the patient's room and being at clinical. Okay? Your job then is to make sure your interventions relieve symptoms. In this case, if you suspect meningitis, what you're going to make sure you do is put your patient in isolation precautions. Now, the isolation precautions is respiratory/droplet, because we need to keep them in there for 24 hours. We need to make sure we get a blood culture, that the blood culture comes back positive for bacteria. We need to get the antibiotics in them. They have to be on that antibiotics for 24 hours, so they will stay in isolation if that's the case. They will stay in isolation until all the symptoms are relieved if it's viral. So we want to make sure before you give those antibiotics that you are making sure we have a blood culture so we can figure out exactly which antibiotic to give. We want to address the other symptoms, right? So one of the symptoms, it also includes temperature. Temperature because inflammation in the brain, and this, if it's bacterial, we have an infection. When you have an infection, you need to make sure you're giving the antipyretic, whether that's Tylenol. Tylenol is usually what's given because we can give it IV. If they're allergic to Tylenol, they may opt for ibuprofen or something like that. We definitely want to also give an anti-seizure medication as a precaution. Most of the time it's a low dose, or depending on how quickly or how bad their symptoms are for the meningitis. Anti-seizure medication because when the brain is stressed, then it could cause seizures. You want to make sure you're performing your neurological assessment often. Monitor for seizures, initiate seizure precautions, make sure that you are watching for worsening increased cranial pressure. What is going to happen is that antidiuretic hormone starts to secrete and a fluid retention starts to happen. And when we have more pressure, that means that we have a higher risk for delusional hyponatremia, and we have an increased cranial pressure. If the pressure gets too much in the brain, because our skull is a definitive area, it can only get so big, the brain can, as a hardcore compilation, a hardcore complication would be to start to herniate, and that's something we do not want to do. So continue to assess for level of conscious changes, increase irritability, the fluid from spinal fluid through their nose and their ears, especially their ears. You would see it there first. So assess nutritional status. We really don't want to cause any increase in anything. You want to encourage the patient to keep their head of their bed up. You want to make sure you're doing that. We want to turn the lights out, decrease stimulation. You don't want mom or somebody petting on them. I know that sounds horrible because you want to comfort, or they want to comfort their children, but Just the stimulation of rubbing them and doing all that kind of stuff can cause the brain to get further irritated. We also want to monitor for hearing loss, intake and output. The pressure can get too bad on the ears that we will start to have hearing loss. We want to determine close contacts with the child, who's been around them. That way, if it is bacterial viral, we can get other people treated or at least check on them to make sure they haven't passed anything to them. If they had a pneumococcal conjunctive vaccine, and it did, which is recommended for children beginning at the age of 2 months to protect them against this meningitis, they also get a booster at about 18 years old. Many people with a history of meningitis also had a week or two prior strep. So we need to ask the questions. Of course, take care of your patient first. You can see chapter 18 in that NCLEX book for any information or more details on the vaccinations. So we have to expect certain things from the physician. And when I say expect, I also mean recommendations, right? So if you do an SBAR with a physician on your assessment and what's going on, you need to also recommend a cerebral spinal fluid, so a lumbar tap. That means you're going to prepare your patient for that. We would expect that the blood work comes back with an increased white blood cell count because they have an infection. Cerebral spinal fluid will be cloudy, an increased protein, increased leukocytes, and decreased glucose in the spinal fluid. Some of the other short-term complications that you need to make sure you're providing interventions for include seizures. Seizure precautions are key. You need to pad the side rails. You need to make sure they're not going to get hurt. We need to make sure that if they do have a seizure, you're putting them on their side. The focal neurological deficits means that they could get blurry vision, that kind of stuff. Subdural effusion, it has a lot to do with the increased cranial pressure. Some long-term effects of this, if it gets too bad before we get a chance to get it under control and get the antibiotic in them, could be permanent epilepsy, permanent hearing loss due to scarring of pressure, cognitive impairment, and hydrocephalus. If those things occur, then there possibly could be a chance to have to put a shunt in. So what do you do about it? You suspect meningitis. Your top 3 things, you're going to have to think about this. You need to ask yourself, what 3 things do I need to do for the benefit of my patient? What 3 questions should I ask my patient? And what order, what is the priority in which I do them? In this case, we want to make sure that everyone understands the head of the bed needs to be up and to decrease that stimulation for the brain. You want to immediately initiate respiratory precautions. We are doing respiratory precautions that includes droplet. Prepare for lumbar puncture. So we have to get that cerebral spinal fluid to make sure that's what it is. If your patient does have a little bit of fluid coming out of their ears and or their nose, we can do a glucose strip. It looks like a glucose strip. It's a cerebral spinal fluid strip to confirm that that is what's going on too. Hopefully they're not that bad because that means their pressure would be really high. So some other nursing interventions. So you talk to the physician, you make some recommendations. The test results come back positive Brudzinski's, the cerebrospinal fluid and the infection. So the doctor places some orders. You're going to expect the blood culture. You're going to expect an antibiotic and the antipyretic, the anti-seizure medication, and then making sure that your seizure precautions are there. So I realize these are numbered 1, 2, and 3. The seizure precautions can be initiated earlier if that's your what you suspect. However, if you don't initiate seizure precautions till you get the results back and then you get your orders, depending on how your question is worded or how your day goes with your patient, then you're going to make sure, first and foremost, you get that blood culture before you give the antibiotic. And that is even the priority over the Tylenol, because we get rid of the fever if we get rid of the bacteria faster than if we just mask it with some Tylenol. Other nursing interventions that require priority action, you're going to make sure you're reassessing that LOC often. Remember that if they get irritable, if all of a sudden their headache goes from just pressure to suddenly severe pain, you're going to do an immediate assessment to make sure we have not increased the cranial pressure. We want to make sure we put them on a continuous pulse ox. Some people tend to hold their breath and do some other things. And remember that if your cranial pressure is starting to go up, that also goes up on the bottom part of your brain, your cortex there, that controls your respiratory rate and your heart rate and all of that. So that's a good first signal. And then we want to monitor the ears and nose for drainage. So that is the long and short. I want you to think about a few things. When you're learning a new disease process, remember that you are looking at it as a perspective from the nurse. You should be questioning when you see your signs and symptoms, what SBAR do I give? You should be thinking about what risk factors could include in this. You should be understanding what things that the physician is going to order so your patient is well cared for, what things you are getting ready to delegate versus having to do yourself, and what the priority of all of those actions are while you're still caring for 3 or 4 other patients. It's okay, you can get it. When you're doing nursing interventions and thinking about them, you can also go back to each symptom. For example, it said headache, right? So we could decrease everything, ask for the antipyretic. If the other thing, let's see, the positive Babinski's and the muscle weakness, we could make sure we have nice comfort positioning and that the patient does not get out of bed. Repeat, the patient does not get out of bed, especially alone. We want to look at the symptoms, see what actions we can do to relieve those symptoms, no matter what disease process we're talking about. We want to teach about any risk factors. And then we need to make sure we know how to prepare for a test. Example, you had to prepare your patients for the lumbar puncture. That means getting consent. The physician needs to talk to them. You need to get consent from the parents. We need to position the patient on the correct side. We need to get things set up for the physician and so on. After the test, that means you are also watching for a decrease in vital signs, LOC, anything that would indicate causing more complications because of the lumbar puncture in itself. We also want to make sure we're preventing those big complications, those long-term and short-term complications that I talked about. Now, let's apply what you learned. Now, when you look at questions, I want you to look at the cues. What are the key words? What are your cues that are bringing you into deciding what's going on? How do you analyze those cues? What's your hypothesis? And then you need to come up with solutions so you can take action, and then you're going to evaluate your outcomes. Okay, so let's get going. The nurse's notes documentation that a child is exhibiting an inability to flex the leg when the thigh is flexed anteriorly and the hip. Which condition does the nurse suspect? So I would hope you get this question right. I'm just giving you some feedback here that, this should be your meningitis answer. You shouldn't be thinking about the rest, right? Very good. So when you're doing this questions, you should be seeing that they're giving you an example of Keurig sign. Next question. I tried to kind of mimic those one-line sentences with drop-down boxes. I couldn't quite get it to do it, so the little dots are a single blank. So blank precautionary intervention should be included in the plan of care with the bacterial meningitis child for how many hours? Your answer is respiratory and 24 hours. Remember, they got to have that antibiotic in their system. So one of the other next gen types question is highlighting in the chart things that indicate a need for you to cue in and be concerned with. So in this case, we would definitely notice that the severe headache is an issue, the positive Burdenski's, the strep, the age is not, temperature is a problem. If the temperature gets too out of control before the antibiotics and the antipyretic does its thing, you can go ahead and put ice if it gets really bad underneath their armpits. That will help, but that is a severity for the temperature. We should, if we're getting things under control quickly, give a broad spectrum antibiotic and the Tylenol to get that down fairly quickly. So make sure you have your IV in too. The history means nothing, right? The appendectomy, the tubes in their ears, the immunizations are current, are nice, but as you notice that you get your first meningitis injection when you're very small. Potassium or white blood cell count is high, potassium is normal, and the cerebral spinal fluid is cloudy with increased leukocytes. So if I was to highlight, I was to highlight the ones on the screen right now. Remember, if you can notice similarities in different disease processes, especially neurological disorders, then you are still memorizing. But when you start learning clear differences, then you are starting to learn, okay? We want to reinforce activities, so I would suggest you taking the time to write a DART note and or an SBAR on what you would recommend to the physician with your findings. Or you can possibly write an SBAR if your patient's symptoms were worsening and you had to think about initiating something for increased cranial pressure. Don't forget to look up your seizure precautions and have a good day.